Personalized care, experienced surgeons, innovative technology, all of these reasons and more are why patients come from around the world to the Las Vegas Neurosurgical Institute. And joining us now to discuss the advances in spine and brain surgery is board-certified neurosurgeon, Dr. Scott Glickman. It's great having you, my friend.
Thank you very much.
You're a doctor of osteopathic medicine, a neurosurgery specialist. You went to school for 20 years for this. You know what you're talking about.
I do.
There we go. This is good. Let's talk about your training and some of your subspecialties. What is it that you focus on? I
focus on complicated problems of the brain and spine. I do a lot of revision surgery, and I personally like to do things that perhaps a lot of other neurosurgeons don't do, which is revising problems that have gotten worse over time. Yeah. I also do a lot of routine problems, herniated discs and spinal stenosis, take out brain tumors and vascular problems of the brain.
No kidding. And what are some of the most common things that you're seeing with your patients?
Typically it's disc disease of the spine, whether it's young patients, old patients. People might have a simple herniated disc and they have leg pain or arm pain, back pain we all get as we get older. Of course. And trying to figure out what the problems are that are causing those symptoms. That's one of the challenges for any neurosurgeon or spine specialist. Absolutely. There's a lot of news that you've been hearing lately, especially when it comes to the Parkinson's world, about deep brain stimulation. Explain what this treatment is and how it works. So deep brain stimulators are, a deep brain stimulator is a specialized device. It's sort of like a pacemaker for the brain. No way. Myself and a couple of other doctors in the city are qualified and actually perform the surgery. I personally perform it awake. And that might seem very scary, but you're nice and sedated. And it's a device that is put in under navigation, where it's sort of like a Garmin for your brain. And it's very specific. You're trying to put in a wire, one on the right and one on the left, from the outside, from about right up here, that's into a structure in the brain that's about the size of an almond. That's about, I don't know, 5 inches deep. And it's put in a way that is it's very specific, obviously, to control tremors and rigidity and the slowness of movement called bradykinesia that happens with Parkinson's disease. It's also used for essential tremor. It also has a new indication for seizures. So there's lots of new technology that is present and on the horizon. Well, just being able to figure out exactly where it is in the brain, to be able to pinpoint, to be able to, it's incredible. The technology's come a really long way. I know when it comes down to spinal surgery, obesity can play a part in that, can't it? Yes, obesity is a big problem in our society. We have more than 50% of the population is overweight, and a good portion of that is morbidly obese or very overweight. So when you are overweight, that puts additional strain on your bones and your joints, and it's effectively compression that's more and more and more. And as we get older, naturally, our bones get weaker, our joints get a little worn out, sort of like the tires on our car, and they need to be replaced, or our tires need to be replaced, engines need to be lubed up. So the spine, as it degenerates, sometimes degenerates to a point that it starts to fall apart. And what we need to do for that is correct and repair things. Obesity just amplifies the amount of stress that's applied. Of course. If you're young and healthy, you're normal, and you can have a blowout of one level. When you are obese and as you get older, it takes a lot more. We're running out of time. I know you have a great team behind you. If people want to get in contact, how do they do so? So I work with a great team of people at the Las Vegas Neurosurgical Institute. I have several partners, and we're all very happy to take care of a wide range of problems. We cover several different hospitals in town and see patients from all over the city and all over the world.
Absolutely. Well, if you're going to have a surgery, why not do it in Las Vegas?
There's no reason you can't have really good neurosurgical care in this city.
Absolutely, no question. And you're providing it. It's great having you, Doctor.
Thank you
so much. Listen, visit Southern Nevada's first choice for spine and brain surgery. It's the Las Vegas Neurosurgical Institute, located on South Durango, just north of DI. Their website and phone number are right there on your screen. Las Vegas Neurosurgical Institute, a proud sponsor of the Morning Blend.